So today we are going to talk about plantar fasciitis. Everything you need to know about plantar fasciitis. So what is plantar fasciitis? Plantar fasciitis is inflammation of plantar fascia. Inflammation of plantar fascia. Then what is plantar fascia? What is plantar fascia? See, plantar fascia is a thick connective tissue. Plantar fascia is a thick connective tissue that connects or that attaches to the calcaneus at the heel, that attaches to the calcaneus at the heel and connects to the flexor tendons of the toes and connects the flexor tendons at the toes. Here it connects, here it attaches to the calcaneus at the heel, then branches out to connect the flexor tendons of the toes. Okay, so inflammation in this structure produces plantar fasciitis. Inflammation in this structure produces plantar fasciitis. So what will be the symptoms? Usually it presents with gradual onset of pain. The presentation of plantar fasciitis is with a gradual onset of pain, where in the plantar aspect of the foot on the bottom of the foot. Plantar aspect of the foot and the bottom of the foot. Usually works with the pressure. Which activities aggravate these kinds of pain? Usually when walking or standing for prolonged periods. Walking or standing for prolonged periods. Okay, again we can find tenderness to palpation. You can find tenderness to palpation. Okay, so there is tenderness to palpation of this area, particularly where the plantar fascia attaches the calcaneum. Where the plantar fascia attaches the calcaneum. That means this patient ইউজুয়ালি আমাদের কাছে আসবে কি নিয়ে, তার এরকম পায়ের তালুতে ব্যথা এই এরিয়াটাতে, এবং এটা সব থেকে বেশি বাড়ে কখন, যখন অনেক সময় দাঁড়িয়ে থাকা হচ্ছে অথবা অনেক সময় সে হাঁটতেছে। এখানে অ্যাসোসিয়েটেড একটা হিস্ট্রি থাকতে পারে যে সে শক্ত জুতা ইউজ করে, যদিও সেটা সবসময় তারা বুঝতে পারে না, হিস্ট্রি নিয়ে বের করতে হয়। Okay, so these are common symptoms, common features. Okay, so how we can manage this patient? Management. So firstly rest. Then we can apply ice, analgesics in the form of NSAID, as usual painkillers. Most effective is physiotherapy. Personally I like this. Most effective is physiotherapy. Steroid injection sometimes it found helpful, but there is some complications. The most severe complications are injecting a drug is painful. Injecting a drug is painful, first of all. Secondly, it can cause rupture of the plantar fascia. It can cause rupture of the plantar fascia. So plantar fascia, it can cause rupture of the plantar fascia. Thirdly, here we can see fat pad. Here we can see fat pad. Okay, so this fat pad can be atrophied. This fat pad can be atrophied if someone repeatedly use this medication, this therapy, steroid injection. Okay, so usually what is the function of this fat pad? It protect the heel from impaction, and it can atrophy if someone repeatedly uses steroid injection for plantar fasciitis. So it's wise to avoid this. Okay, so better is physiotherapy. So most commonly we can use two therapies. First one is in the second point I have already discussed. We can apply ice in this form. We can apply ice it will find helpful, and it will really pain. Okay, so another one is plantar stress exercise. Plantar stress exercise, you can also find this one helpful, plantar stress exercise. And another option is heel cushion. We can use heel cushion. This type of product we can found any pharmacological shops, heel cushion, and we can use this. It will reduce our pain. It will reduce the pain of plantar fasciitis. Okay, thank you.